I'm Janet Perkins, and I'm a program officer at Enfants du Monde. We are a non-governmental organization based here in Geneva. And I'm going to be switching gears a little bit in my presentation today. First, I'm going to be discussing our work in a developing country in Burkina Faso, so that's a little bit different. And also, it's a little bit more programmatic and not as research-based as the previous presentations. Before I begin, I would like to acknowledge my co-authors. First, Aminata Bargo, who works for the Foundation for Community Development in Burkina Faso. She works for our local partner in Ouagadougou, and Cecilia Capello and Carlo Santarelli, who are also at Enfants du Monde. So first, to give a little bit of background, Burkina Faso is typical of sub-Saharan African countries in that women and newborns face great risks. And you can see some of the indicators here, and specifically the utilization of healthcare services is very low. You can see that only slightly more than half of women are attended by a skilled attendant at birth, and only 18% of women receive the recommended 4 antenatal care visits during pregnancy. Now, the government of Burkina Faso is very committed to addressing this, and in 2006 they elaborated a strategy for reducing maternal and newborn mortality called the Roadmap. And as one of the core pillars, they adopted the World Health Organization's framework for working with individuals and families to improve maternal and newborn health. It's kind of a mouthful from here on out. I'll refer to it as the IFC framework. And Enfants du Monde, in collaboration with the Foundation for Community Development Burkina Faso, we've played a central role in supporting Ministry of Health to actually implement the IFC framework, which is more or less a health promotion component of a broader maternal and newborn health strategy, which aims to empower women, men, families, and communities to take control over their resources and improve maternal health, and to increase access to and the utilization of the quality maternal and newborn health services. I won't go into detail on the slide. This just shows a little bit the trajectory of the program and when different things have taken place. Essentially now we are implementing the framework in 5 districts. Currently, it is envisioned that eventually the entire country will be covered by the program. As one of the first actions in implementing the framework at district level, a participatory community assessment is conducted, and this is an assessment which includes, which consists of conducting a series of roundtable discussions with community members, with community leaders, with health workers, and during these discussions, the community members, they discuss what the major problems are in the area of maternal and newborn health, what the barriers are for improving maternal and newborn health in the area, and they work on developing solutions to overcome these barriers and to address these challenges. Not surprisingly, one of the major problems that community members have identified is that women and families are hesitant to seek health services because they've had negative experiences when they seek these services. They've had poor interactions with healthcare providers. They've even expressed being mistreated by healthcare providers. And obviously there's many factors that contribute to this. And this isn't surprising, as research in several different countries have shown the same thing. And we've even talked here about how healthcare providers can, that's kind of the focus of our conference here, is how healthcare providers can provide more person-centered care and show more compassion. And so community members really wanted to focus on this. They thought that if the interactions improved between women and providers, then the demand would increase. Women and families would seek the services. And so in order to do this, we, along with the Ministry of Health, decided to train healthcare providers to improve their interpersonal skills and in counseling women on maternal and newborn health issues. Healthcare providers were invited to attend a 5-day course on the subject, and we started by adapting the World Health Organization's manual for counseling for maternal and newborn health to their context. And this manual covers many different themes, but a big focus is just on basic counseling skills and how healthcare providers can interact with women to make sure that they understand the things that are important, and that they make health promoting decisions, and that they seek health services when they need it. So between 2011 and 2012, 175 healthcare personnel were trained during these training courses. And the participants were very enthusiastic about the training, but at the outset of each course, they discussed what some of their major challenges were. And of course there's many, but they did express that they don't have the knowledge of how they can better work with women and families. They were very eager to learn how they can better do this. They recognized that they needed capacity building in this area. So just to talk about some of the results that we've seen so far, in terms of knowledge, at the beginning of each course, the participants completed a pre-test and then the same test as a post-test following the course. And at the beginning, only 13 of the participants scored 85% or higher, which was determined as the threshold for passing. At the end, 95% of participants passed, and 50% of the participants had a perfect score. So obviously, what we really want to know is how this translates into behavior, into action. But even so, this was encouraging at the beginning. And so what the evidence that we have now is still very much preliminary. It's going to require a thorough evaluation to really understand how the training has translated into action, and how that in turn has translated into the perceptions into improving perceptions at the community level. But anecdotal evidence, especially by managers in the healthcare facilities, suggests that the providers have improved their interpersonal skills working with women and families. And specifically, the providers were taught as one important part, or they determined one important thing was to have men and other family members accompany women to health services. And men have increasingly been accompanying women to health services following the training. Also, providers have taken action to create links with the community. They started working with community leaders and influential community members to bridge the gap between the health services and the community, so that they can, on the one hand, have messages transmitted to the community, and also enlist the support of community leaders and members to encourage women to attend the needed health services. So in conclusion, these early observations are quite promising, and we will be evaluating to see in the future how this has translated into action, but we are greatly hoping that it is translating into more person-centered care for women and families in maternal and newborn health. So thank you.